Good morning, everyone. Okay, I just want to say a couple of things real quick. Can everyone hear me all right?
Yeah.
Okay, good. So I guess there's all these questions about what's going on with different things. So let me just tell you what I know so far. So with testing is still kind of up in the air. So I know originally I told you guys we'd be testing this week on Thursday for test 1. Right now, that's up in the air. I don't think we're going to be doing it. They have been trying to work on some kind of testing thing so that they can ensure people aren't cheating on their tests because you'd be doing it from home. So I guess they have some kind of product that they want to test out today. So if you guys can, I would appreciate if you would stick around after we're done with this. And this lady from the home office wants us to go to this one spot on Canvas, and supposedly there's going to be a practice test there, and we're going to try it out to see if it works. So I guess if we get good results from that, then maybe they'll let us go ahead with the testing. We'll see. So that would be really helpful if you guys could do that. So she told me to have you guys go into your Canvas, and there is a section on the left-hand side that says conferences. So you would click on that, and then supposedly she's going to have something in there that just is labeled practice test, and you would just click on that, and then she would talk you through what to do from there. So that's the plan after we're done here, is for you guys to go there and try and do that. The other stuff, for clinicals, we are going to be doing something called vSim for Nursing. And it's going to be housed on the Points website. So I have access codes and information about how you guys get in there that I'll probably send you later today. If you guys aren't muted, please mute yourself real quick so everyone can hear me all right. Thank you. Anyway, I'm going to go ahead and send that stuff out later today, so watch for that. It's just going to tell you information about how to get in there and set up your Point account. And it's really kind of a cool program, so I think you'll like it. And then what's going to happen is I'm going to post in Canvas which virtual sims that I want you to do, because there's only a few that you're going to have to do, you know, to make up for your hours. I think it's a total of maybe 4 or 5, something like that. The one clinical group has more hours than everyone else that they have to make up, so they're going to have 5, and then everyone else will have like 4 of these to do. So the thing is, you will get in, you'll do these things on your own time. You don't have to do it during your normal clinical time. You can do it whenever. And then there's supposed to be a Dropbox on Canvas that you turn this stuff into. And then your clinical instructor will look it over, and they will give you comments back on it. So that's how you're going to do your clinical time. So after you guys get your information about how to get in there, there's an orientation thing that you have to do. So that's what you're going to be responsible for doing first this week. So that has to be done, you know, soon. Trying to think what else I wanted to tell you. Oh, I've been getting a lot of emails from people about assignments. Assignments, continue to just turn them into me through email. I don't have a Dropbox set up anywhere, so just give them to me in email. Everything can be due by midnight the day that it's due. That's fine. I know everyone's kind of stressed about how everything is going, so I'm fine with that. Questions about anything specifically? Okay, so let's go ahead and just get started with what I was going to do today. So yesterday I spent a ton of time recording lectures, and I'll just be honest, I'm having a hard time like loading them onto Canvas because they're so big after I do a recording. So I've found a way that I can do it on YouTube, but it's still kind of giving me a hard time. So I'm going to work on that again later today to see if I can get it loaded for you guys. So I'm just going to kind of go over some highlights of things through the GI system that I would have talked about with you today in class. There's really like 4 PowerPoints that we would go through this week. So I'll just kind of go over highlights of a couple of things from those PowerPoints with you today. All right, so the first PowerPoint that we would have done would have been GI assessment. So in that PowerPoint, I'm not going to go through everything with you, but I'm just going to point out some highlights so that you guys can take some notes. So in the GI assessment PowerPoint, it talks about the whole process of digestion in the beginning. And the thing with that is I want you to make sure, you guys, I need you to be on mute because I can't hear. I keep hearing people's kids and stuff. So please put yourself on mute. Thank you. Okay, so anyway, the process of digestion. So the things that I really want you to pay attention to. So in the stomach, what is the most important thing that goes on when food goes down through your digestion system and gets into the stomach? So the important thing that I want you to know is that you have a lot of acid in your stomach, and by the time food gets down to there, it breaks everything up into usable pieces so that you can absorb your nutrients like you should. Absorption doesn't necessarily take place there, maybe a little bit, but most of absorption is going to take place in your small intestine. The nice thing about the stomach, though, is like say you take something in that has bacteria mixed in with it, it would kind of help kill it, you know, because it's in such an acidic environment. So as you take food in, that can kind of protect you in a way, I guess you could say. So again, you know, as you swallow things through your digestive system, once it gets to the stomach, it's just going to break everything down so that it's in smaller pieces that are more usable for you. So then with the small intestine, that's where you start getting all the absorption that goes on. So in there, that's where you start, sorry, I'm just trying to get on the right page. So in there, that's where you start getting your real absorption that goes on, where you get, you know, all of your vitamins and minerals and everything else that you need. In the large intestine, once food gets there, then everything starts to slow down a little bit. And now you have absorption of water, and it kind of gets things ready to be evacuated. So you don't have as much moisture in there, and it causes your stool to form, and eventually you'll be able to evacuate what you had there. A couple of other things I just want to point out in here. There is a slide that talks about older adults and what's important to them. Older adults have a lot of differences compared to the younger generation with, you know, how everything goes with them. So some of the things I mentioned here, they have difficulty chewing and swallowing. A lot of them have dentures, and some of their dentures don't even fit good enough. So you may end up having issues with, you know, chewing your food and things like that. So that could be a thing. They have a lot of food intolerances. So as they get older, they don't absorb things as well. So they may be, you know, deficient in different vitamins like vitamin B12. They end up having a lot of reflux and heartburn. Everything kind of goes through their system a little bit slower. So they have decreased motility and transit time. So that's why they always, you know, complain of constipation. And then again, you know, decreased absorption of nutrients. So those would be some things I would want you to know about older adults. In the assessment portion of this PowerPoint, and I'm not going to go through everything, I'm just going to pick out some highlights. Some of the stuff that I think is kind of important that you should know about would be, you know, when you have blood in your upper GI tract, it's going to produce a black tarry color with your stool. So if someone has a GI bleed and you see that it's a black tarry color, that's going to indicate to you that it came from their upper GI system. If they have a stool that is more of a bright or dark red, that's going to indicate that it's from the lower GI tract. And then the very last thing here I wanted to say is if it's a lower rectal or anal bleed, then usually you're going to see streaking of blood on the surface of the stool, or if blood is noted on the toilet tissue, that would mean that it's a lower rectal or anal bleed. So a lot of the middle part of this PowerPoint is just talking about assessment and getting you reacquainted with some of the things that you should know with that. So I'm not going to really go through everything here, but one thing I did want to point out, as you go through this PowerPoint, there's a section where it talks about auscultating bruits. And I think a lot of people kind of forget that and don't realize that that's a thing that you should be doing with your assessment. So remember, a bruit is going to be a whooshing sound that you hear. And so on the one slide of the PowerPoint, it talks about the spots where you should be listening to. So like there's a right renal artery spot, there's an aortic spot, left renal artery, left iliac, left femoral, you know, so those would be the spots you should be listening to for that. And so remember, when we say that there's a bruit, this just means that you're worried kind of about an aneurysm. So you're worried that there's a weak part in that vessel that is kind of bulging out. And as you get more turbulent blood flow through there, you're worried that that's going to break open and cause a bleed. So that would be something that's really significant with your assessment. Okay, so the last part of this PowerPoint goes over all these different diagnostic tests. So definitely make sure that you look through that. I'm not going to read through every one of those because I kind of go through it pretty good in this PowerPoint. I think you guys would be able to be okay with most of this. One of the things, though, that I want you to make sure you understand, definitely with the different EGD, colonoscopy, that type of stuff, make sure you know details about those. And then like towards the end, we talk about the liver biopsy. That's kind of significant. So I want you to make sure you know that really well. So the liver biopsy, if you ever had to have a patient that has that done, so what they do is this person would be given some kind of like a local anesthetic. So they're going to inject that into the right side of this person to numb up the area. And then they're going to take a needle that they insert in through the ribs to that right side where the liver would be. So this needle is going to like pull back a little bit of liver tissue inside of it, and that's what you're going to send off to the lab. So it's really kind of a, it's invasive in a way, but it's kind of risky in a way as well, because you're right there next to the lung. And so you would be at risk for a pneumothorax, and then you also would be at risk for bleeding. So bleeding is a really big deal here. So after this procedure, you would just put some type of dressing over that, and then this person is encouraged to lay on that side. So they have to lay on that right-hand side, even though that's where they just did the procedure, because you're trying to get, you know, some pressure put on that area to get that area to quit bleeding. So that's kind of important. So make sure you know those things about that. And then the last slide talks about a paracentesis. So if someone has ascites, so they have fluid in a place where it not normally is. So this person usually would have fluid accumulated in their abdomen, and it's going to make them look like they're pregnant. So all of this extra fluid that's there is going to make them be really short of breath. It's going to possibly cause other issues as well because of all this extra pressure from this fluid. So they would take this fluid out by doing this procedure called a paracentesis. They can take out a ton of fluid sometimes when they do that, probably between 4 to 6 liters, and it's drained out by gravity. So the thing is, this can cause this person to go into hypovolemia because now you're taking all of this fluid out, and the fluid that normally is out around the cells is going to be like really low. So sometimes what they will do is they'll administer albumin. So albumin, remember, is not going to be a crystalloid, it's going to be a colloid. And it's like a thing that's kind of small. So when you get it out, it's in a really small bag. So you don't need to give as much as you normally would for a crystalloid solution. And then after you give it, usually that will help the patient quite a bit. So a lot of times this patient might have a low blood pressure when they come back from getting this paracentesis. So after you give them the colloid, this albumin, it usually will help that as well. All right, so that's some highlights from that first PowerPoint. Any questions so far? Okay, so I think this is going to cut me off quicker than I thought it would. It's told me I only have 10 more minutes. So I'm going to quickly kind of go through a little bit about the GI treatment modalities as well. So that would be the next PowerPoint that we normally would have done today. This chapter is pretty much all about NG tubes and PEG tubes. So like the first part of it just says, hey, what are some reasons why someone might need one of these types of tubes? So it lists them all right here on the PowerPoint. So hey, decompression of the stomach and removing gas, lavaging the stomach to remove ingested toxins. So this would be like, hey, maybe I work in the ER and someone took an overdose of a bunch of things. So then I would put this NG tube down, lavage their stomach to clean it out and suck all of that bad stuff out. Sometimes you can use this to diagnose GI disorders. You can administer tube feeds, fluids, or medications through this. You can compress a bleeding site. And then also you can aspirate GI contents for analysis. So there's all these different kinds of tube types that I have listed here, and then I have some pictures of what they look like. The one in particular that I want to mention is that Sengstaken-Blakemore tube. So this is a tube that you would only put in if someone had like liver failure and they had esophageal varices. With this procedure, this tube is humongous. You would only put this in for that because I don't know if you can see the picture of it if you're looking at your PowerPoint, but there is 2 balloons that you would blow up to keep this in place. So there's an esophageal balloon and like a stomach balloon that you would, inflate. So the esophageal balloon is because you're having bleeding esophageal varices. So all of this bleeding, this GI bleed is happening there, and this puts all of this pressure on those sites to get them to quit bleeding. And then the other balloon is just to kind of keep it in place so it doesn't migrate where it shouldn't be. So this would be a tube that you would put in, this person's probably in ICU, and this tube would only be in for a total of 12 hours. You can't have it in any longer than that, so it's kind of a temporary fix. So the reason for that is because if you leave it in for longer, it can cause necrosis of some of your tissues and stuff like that. So that is something that I just wanted to call your attention to. Then there's a picture of the Dobhoff here. A Dobhoff is just a way that you can give tube feeding to someone. I put a slide on here about the steps of putting an NG tube in, just to remind you of that. And then there's just some like little tips about, you know, how to take care of an NG tube basically. So this talks about irrigation and what you can do with that. Irrigation sometimes is a good thing to do every so often to make sure that it's working really well. You know, with the tube that we're all used to, that the tube with the blue port off of it, you have to like make sure that that is up above the waist of this person. So like if this person's laying in bed, you don't want that tube like facing down to not drain really well. You want it to kind of be up above their waist. So you're going to lay that tube up that way so that it works better. This talks about, you know, giving frequent oral hygiene, preventing tension on the tube, you know, all those types of things. So some of the complications that you can have from a tube would be fluid volume deficit. This would be, you know, hey, maybe I'm doing lots of suctioning. And so, of course, maybe this person would be having that fluid volume deficit because you're getting rid of fluids and electrolytes and causing them to be kind of dehydrated because you're getting rid of all of that, you know, from them having nausea and vomiting or whatever. Pulmonary complications would be aspiration would be your biggest one that you're going to be concerned about. And then tube-related irritations, that would be just from having the tube in. So again, you know, if you can imagine having one in, if it's in your nose, it's going to be rubbing, you know, against the side of your nose. So that's going to be an irritation. And then just the tube itself down into your esophagus and where it goes, it's going to be rubbing in there as well. Don't forget that when you remove an NG tube, you always should flush it first. So they say to flush it with 10 milliliters of water or normal saline to make sure that it's away from the gastric lining, that it's not sticking there. And then you're going to take it out. With tube feedings, remember you can do tube feedings 2 different ways. You can do it by gravity or you can set it on a pump. And usually by setting it on a pump, people tend to tolerate that better because they get it a little bit slower. And so like say someone is not tolerating things really well, usually you can get them to tolerate their tube feed better if you give it to them a little bit slower. So that would be a good thing to do. It talks about how to clear up tube obstruction. Our book talks about just using warm water. So make sure, you know, you do that. There's a different way to unclog a PEG tube compared to an NG tube. NG, you always just want to use warm water for sure. With a PEG tube, sometimes if that doesn't work, they will tell you to do digestive enzymes down through there. And believe it or not, sometimes that works really well. All right, my time is running low here. It says I have 1 minute 30 seconds, so I'm going to try and see if I can get a couple more things in here. If this cuts off, you guys can just sit here a minute and I'll see if I can get back in and invite you all again to another one real quick so I can finish what I was going to say. Okay, so there are some advantages to having a tube feed over having TPN. So tube feed is going to be lower in cost, it's going to be a little bit safer, and it's better tolerated by the patient. And if you had to send someone home on it, they would do better with that than they would with TPN. So that's kind of some advantages. Okay, guys, I'm going to end this real quick, and then I'm just going to see if I can call another meeting and maybe we can finish what we were doing.